infection control we're doing really well on, girls.
Two-thirds of the money spent by local NHS trusts goes on staff costs, primarily pay and pensions. But the NHS is facing what the government describes as the biggest financial challenge in its history. Though significant savings are being forecast in other areas of expenditure, the Department for Health says employers cannot pay staff more if they also want to improve quality and protect jobs.
Statement, the Chancellor of the Exchequer.
In his last autumn statement, the Chancellor George Osborne said public sector pay, including the NHS, would go up by 1% next April. But the current system of incremental increases, where staff not only receive a pay rise each year, but also move up a pay grade, will add an extra 2% to that. The government says such deals need to change. The government says it wants a permanent shift in culture to make the NHS an organisation more focused on its patients than its staff. In the report, it says staff should be paid more on the basis of what they do for patients than on the amount of time they've served. The NHS is a thorny issue for the government, as shown by this demonstration outside the Conservative Party conference last weekend, and health unions are describing this report as inflammatory and insulting. The review panel will make its final recommendations on NHS pay early next year. Ben Ando, BBC News.